So you start a new medication, and a few days later, your vision feels, well, just a little bit off. You know that quiet dread that starts to creep in, right? You start asking yourself, is this normal? Is this serious? Okay, let's dive into this head-on. Today, we are going to turn that anxiety into a clear, practical plan for anyone taking medications like Ozempic or Wegovy.
That feeling, that's exactly what we're tackling. It's that moment of uncertainty where you're just not sure if you should be calling your doctor or, just waiting it out. It's a really common fear, and it is completely understandable.
And this right here, this is our whole game plan for the next few minutes. We're going to replace all that guesswork with a clear strategy. The goal is to empower you with the right information so you can feel totally in control of the situation.
So let's just cut right to the chase, the main takeaway. Yes, some recent studies do suggest a possible link between these drugs and certain eye issues. But, and this is a big but, the key here is that this is a manageable situation. It's all about having a plan for monitoring your vision and communicating with your doctors. It is absolutely not about panicking.
So, what's all the new buzz about? Well, the conversation around eye risk has gotten a bit bigger. For a while, the main focus was really on one specific type of eye concern. But now, new evidence suggests we should actually be looking at two distinct possibilities.
And here they are, side by side. On one hand, you've got diabetic retinopathy. Now, this is usually a temporary worsening of an eye condition you already have, and ironically, it can be triggered by a really rapid improvement in your blood sugar. On the other hand, we have something totally different called NAION, which is a rare kind of eye stroke from a loss of blood flow to the optic nerve. You've got to know, these are two completely different things.
You might see some scary headlines out there saying these drugs cause eye problems, but it's so important to understand the difference between correlation and causation. Right now, the research shows a correlation. It's a signal that two things are happening around the same time. Think of it like an early warning system that tells scientists, hey, maybe look a little closer over here. It's not a final verdict.
This quote from a patient it nails the difference in what these things can feel like. A temporary blur from your blood sugar changing can feel like you just need to clean your glasses. But a more serious issue, that might feel like someone literally dimmed the lights in one part of the room or like a permanent shadow is there. That distinction is so incredibly important.
Okay, so this brings us to the big question, right? Are you at a higher risk? Let's break down the factors that mean, yeah, maybe some closer monitoring is a really good idea.
The group that doctors talk about the most are people who already have some diabetic retinopathy to begin with, especially if their blood sugar, their A1C, is dropping super fast. Now, that doesn't mean getting better glucose control is bad, it's great. It just means the pace of that change really matters to those tiny, delicate blood vessels in the back of your eye.
And then there's what you could call the vascular risk stack. These are other health factors that kind of pile on and can make your blood vessels a bit more vulnerable in general. So if you're dealing with things like sleep apnea, high blood pressure, or you have a history of smoking, it's just another reason to get any new vision symptoms checked out, no questions asked.
So when do you need to be the most on guard? Well, it looks like the first 3 months are really the key window. This is when you're just starting the medication or you're upping the dose and your body is going through this big adjustment period. It's also when it's super easy to get confused and maybe dismiss a symptom that's actually pretty important. Okay, so we've laid out the potential issues. Now for the most important part, what you can actually do about it. This is where we stop worrying and start preparing with a clear, practical toolkit. Let's talk about 3 common mistakes that are so easy to avoid. First, starting the drug without getting a baseline eye exam. I mean, without that before picture, how can your doctor know if something has changed? Second, just assuming any blurry vision is from staring at your screen too long. And third, and this is a big one, stopping your medication on your own because you read something scary. Working with your doctor is always the safest path. I just love this quote from a caregiver's story. It perfectly sums up our whole approach here. Being prepared with good info is what allows you to act fast and act smart. And really, that's the true definition of staying calm when things get stressful. This brings us to probably the most practical tool in this whole explainer, what we're calling the decision card. Think of this as your cheat sheet. If you have sudden vision loss in one eye, that's an emergency. Go now. If you have a blur that just won't go away in one eye, that means a same-day trip to an urgent eye clinic. And if it's just a mild blur that comes and goes in both eyes, that calls for a prompt call to your doctor with your notes ready.
Let's make that even simpler. Think of it as a 3-step mental checklist. 1. Identify the pattern. Is it sudden? Is it in one eye? 2. Classify the urgency based on that pattern. And 3. Communicate clearly. When you call, have your timeline and your notes handy. This whole process just takes the guesswork right out of it.
To make that communication even more effective, here are 5 specific questions you can ask the doctor who prescribes your medication. You're essentially asking them to help you build a personalized safety plan before any issues pop up. Things like, what's the safe pace for my A1C to come down? And can we add an eye risk plan right into my chart?
And here are 5 matching questions for your eye doctor. These questions are all about getting your entire care team on the same page. You're asking, what's my baseline? And can you please send a note to my other doctors so you're both in the loop? This creates a fantastic safety net for your vision.
Okay, we have covered a lot of ground. But if you only walk away with one single thing from our entire chat today, I really want it to be this next point. Out of everything we've talked about, all the risks, all the plans, all the questions, there is one single powerful action you can take like today.
And here it is. The single most powerful thing you can do is to book that baseline eye exam. And when you go, just bring a simple one-page timeline with your medication start date and any dose changes. This one action, it transforms you from being a passive worrier into an active, prepared partner in your own health. It is the path from concern to control.
So, I'll just leave you with this question to think about. Is your health plan built on reacting to anxiety and scary headlines, or is it built on proactive, clear-eyed action? Because with the right plan, you really can manage your health and protect your vision with confidence.